Good morning, everyone. We'll begin today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. This morning, Dr. James Hildreth, President and CEO of Meharry Medical College, will address us in a pre-recorded video message. We're also joined by Dr. William Schaffner, Professor of Preventative Medicine, Department of Health Policy, and Professor of Medicine, Division of Infectious Diseases at Vanderbilt University School of Medicine, who is joining us by WebEx video conference, and DeCosta Jenkins, President and CEO of the Nashville Electric Service. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. Now, after 53 days, we're going to move on to phase one. Considering the overall progress Nashville has made, and after performing the most aggressive countywide testing in the state of Tennessee, we will start phase one of the roadmap for reopening Nashville on Monday, May the 11th. Now, phase one reopening is not a broad reopening. It is a more targeted next phase of response to the disease. The goal is to get us gently back to work while managing with the presence of the disease in our community. Now, in setting a policy response to a new disease during the middle of a pandemic, we don't have all the answers. We are learning and adjusting. There will be difficult choices ahead, and the next phase will be harder in many ways as we must continue effective and enforced social distancing while restarting the economy. We're going to deploy new tools and strategies to do that, and you, the public, have to be even more involved. Now, we have a passing grade from our health benchmarks, but not a completely perfect grade. We aren't pretending to be perfect in passing this test. Positive cases will naturally trend up with increased testing. But we have successfully protected our hospital capacity. Now, last week on April the 30th, we were supposed to have opened the Music City Center as an emergency 1,400-bed hospital. And it's a prayerful event that didn't happen. Our hospitalization and mortality rates are relatively low. Our transmission rate could be better, but is still around 1 after several weeks. The time for the disease to double is flat, always an important public health metric. But next, I want to show a graph that all Nashvillians should be extremely proud of, and it reflects everyone's great work during the last 53 days of Safer at Home. It shows the line of where the disease was headed and where it is now in the community. Now, this first Safer at Home response allowed us to avoid calamity. Now, Dr. Jahangir will go into more details, but I want to thank him, the Public Health Department, and all of Nashville for making it possible to go from the very worst expectations to now thinking about how we go forward with the presence of the disease. How do we manage? We aren't an island. People have to get back to work, and we have to provide a path to do that safely. Now, our 14-day average positive is persistently slightly on the incline. Over the weeks, it is averaging 80, 90, 100. But that's a huge change from what it could have been, 400, 500, and 600. Ideally, it would be disappearing, but no one thinks that will happen until there is a vaccine. Now, Safer at Home did not keep everyone equally safe, and the next phase has to do that better. That means protecting essential workers, seniors, and preventing clustered outbreaks better. Use contact tracing to make a direct and targeted response to the disease. Have massive amounts of testing, masks, social distancing protocols. It means enforcement. We have the right to be safe, and to be safe not just at home. It also means that you are the partner we need. The public has to be involved in expecting and requiring the safe operation of business, keeping staff and customers safe. Reward businesses that take special care to show concern for public health and safety. In a kind and courteous way, demand it. Today and tomorrow, we will go into more details about how to adopt the Safer at Home framework to be more effective in the next phase, to keep populations safe that have not been kept safe in the original rollout of Safer at Home. It's important to bear in mind that several unique features of Nashville make our reopening process different from other areas across the state, and it's important to get it right the first time without interruption. Our size, population density, number of current cases, the number of businesses that operate here, and our global tourism industry all make Nashville's safe reopening critical to the region. And accordingly, Nashville's reopening roadmap has been tailored for our community. This afternoon, we're hosting webinars for religious congregations and residents 65 years of age and older, and tomorrow's webinar is designed for the hospitality industry. You can visit covid19.nashville.gov for more details. A sustained, successful reopening requires the confidence of both consumers and workers, the backbone of Nashville's economy. We must all work hard to earn that confidence as we begin phase one and ensure all our neighbors can safely work, shop, and dine out, and freely participate in Nashville's economy. All Nashvillians have the right to be safe and should insist on that right. Businesses must take precautions to protect workers and their customers. And all Nashvillians must take care to maintain social distance from each other, wear face coverings when you are out in public, and stay home if you are not feeling well. Now, yesterday, the Metro Public Health Department received 25,000 cloth face masks from the state's COVID-19 Unified Command to distribute to Nashville residents free of charge. And we are coordinating with our partners at the state to request additional masks, as our initial shipment has already run out. This remarkable response by Davidson County residents demonstrates that Nashvillians are clearly eager to do the right thing to protect themselves and their neighbors in the era of coronavirus. Now, order number 4 requires all businesses to post signs reminding the public to wear face coverings. And a new public health order will require local businesses to screen their employees daily for symptoms of COVID-19. Screening requirement details will be made available by Monday morning. Compliance with the roadmap for reopening Nashville is essential to a successful restart. Enforcement teams comprised of Metro Health and Metro Police personnel will continue to patrol our community and to respond to suspected violations reported to Hub Nashville. Metro Public Health is adding 20 temporary enforcement employees as we enter phase 1 to keep our residents safe. If you think you have symptoms of COVID-19, do not hesitate to call the Metro COVID-19 hotline at 615-862-7777, which is open every day from 7 a.m. to 7 p.m. And all services through the community assessment system, including COVID-19 tests, are free of charge to all Davidson County residents. Metro's community assessment centers are now open 5 days a week, Monday through Friday, from 9 a.m. to 3 p.m. to protect public health and support employee screening requirements. Until the beginning of phase 1 on Monday morning, Metro Public Health will extend the Safer at Home order, so I urge everyone to help us further flatten the curve of the coronavirus by remaining at home whenever possible and only running essential errands through the rest of the week and into the weekend. Now, Dr. James Hildreth, President and CEO of Meharry Medical Center, graciously sent us a pre-recorded video message today to provide his insight into the coronavirus and our community's response. And this morning, I want to welcome Dr. William Schaffner, President of Preventive Medicine and Health Policy at Vanderbilt University School of Medicine. Dr. Schaffner is a prominent authority on infectious diseases and is joining us this morning by video conference to discuss Nashville's phased economic reopening. Now, meanwhile, NES crews have restored power to more than 119,000 residents who lost power caused by the damaging winds on Sunday and Tuesday evening. Approximately 12,000 residents remain without power as of this morning, And I want to welcome DeCosta Jenkins, President and CEO of Nashville Electric, who has returned to provide us an update. You can request debris removal from public rights-of-way by calling 311 or visiting hub.nashville.gov at any time. And please visit Metro's COVID-19 website, where you can contribute as you are able to the COVID-19 Response Fund, or learn how to obtain direct financial, food, mental health, and social service assistance. And I'll turn it over now to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. We had 2 additional deaths as a result of the virus yesterday, a 74-year-old gentleman and a 75-year-old woman, both of whom had underlying conditions. My sympathies go out to their families. This brings the total number of fatalities in Nashville to 35. Now for the confirmed cases. We have 3,432. That's an increase of 86 cases in the last 24 hours. 1,641 of those are active, and 1,756 residents have recovered and have been cleared from the virus. Now, as the mayor said, phase 1 of our reopening plan begins Monday. Now, we've always said that data will drive our decisions, and until there is a vaccine, we cannot eliminate the virus. So from day 1, our goal has been to manage the disease. We're looking at multiple metrics and not just one to see how well we are managing the disease. So let's take a look. As the mayor showed in a slide earlier that we'll put up again, the slide shows us the story of COVID in our community from the beginning. Daily new cases on the date of collection, the rolling average trend for cases, the rolling average of daily tests, when the Safer at Home order was initiated, and the projected trajectory if Safer at Home had not been implemented. As you can see, the trending average is indeed slightly heading upwards, but I want to highlight a few things. First, the rolling average of daily tests has been extraordinarily elevated, and having run statistical data, we see a direct correlation between the number of tests that have been conducted and the fact that our incidence has gone up slightly. More so, clusters at the fairgrounds and the Tyson plant have impacted our trend numbers. This is why it's so important to have a strong public health infrastructure and why testing. If we didn't have this, we'd be seeing around 400 new cases per day, which would overrun our hospitals. But because we have this strong infrastructure, we're able to quickly identify, isolate, and control the spread of this disease. But as I've said from the beginning, we're looking at more than just one metric. We're also looking at doubling time. How many days it takes for the number of coronavirus cases to double is an important metric. The shorter time frame, a steeper curve, the faster the virus is growing. Now, Nashville's doubling rate has been stable at over 16 days since early April. To put that in perspective, in early April, New York's doubling time was 4 days, and California's was 6 days. As the virus usually runs its course in about 14 days, a doubling time greater than 13 days usually allows for stability in our case numbers. Another metric that's important to us is the percent of cases that have positive results. The test positivity rate is a good proxy for the severity of the outbreak in an area. In fact, just recently, the World Health Organization advised that communities that see around a 10% positivity rate are testing enough people and have a good idea of the prevalence of the virus in the community. Well, again, since early April, our test positivity rate in Nashville has hovered in the 10% range. This means that the severity of the outbreak in our community is stable. Now, mortality rate is another metric that we mention, but we don't often talk about. While we do more in every death, we do have a low mortality rate here in Nashville. Our mortality rate is about 1%. Now, to put that in perspective, Tennessee is about 1.7%, and in the United States, the mortality rate is nearly 6% currently. Now, as I mentioned earlier, contact tracing is key to opening safely. We must investigate all cases so we can quickly identify clusters that may crop up. A great example is our response to a recent cluster within our homeless population and in Southeast Nashville, which we were able to quickly get to and prevent a broader community spread. Now, we have a strong team of 75 investigators that we're growing continuously, and we'll continue to add resources as we reopen the city. Furthermore, our testing capacity continues to improve. We've expanded the community assessment centers to 5 days a week, and beginning next week, we will implement a mobile unit, which will be able to further expand access to testing in our community. Hospital capacity, both regular beds and ICU beds, continue to be in the satisfactory range. From the beginning, we have said one of the main reasons we need to flatten this curve is to protect our hospital capacity, and I'm proud to say we've done that. As the mayor said several weeks ago, we were planning for a 1,400-bed auxiliary hospital at the Music City Center, and that was scheduled to open April 30th, and now we don't need that. Now, looking at our dashboard, 4 of the metrics are green, 2 are yellow, but we've said not all metrics need to be green when we open up. So based on all the data, especially the levels of testing, the public health capacity, and hospital capacity, coupled with the doubling times in our case positivity rate, the coronavirus task force recommendation is to start phase 1 of the reopening plan. Now, what does phase 1 look like? Frankly, it looks a lot like what you've already been doing. Stay at home if at all possible. Work at home if you can. Residents over 65 and those with underlying medical conditions really need to stay at home and take extra precautions. Residents should wear face coverings in public and no gatherings of more than 10 people. Now, the changes in phase 1 are that restaurants and bars can serve food with the open dining at a 50% capacity. Retails and other commercials can also open up at 50% capacity. Now, all employees must wear face coverings, and employers must screen employees daily, including temperature checks. Again, as the mayor mentioned, for more information on this plan and on the roadmap, please go to covid19.nashville.gov. Now, we're ready to take the first steps of phase 1 and reopen, but we really do need your help. Now, when we faced the tornado a few months ago, Nashvillians quickly answered the call and volunteered to help their neighbors. And when we faced the virus now over 50 days ago, again, you answered the call. But now as we start to reopen Nashville, we really need you. Stay at home unless necessary. Keep your distance, wear face coverings when you're out, and take care of your loved ones. And also, patronize businesses and retailers that are following these rules and helping our community get back to a stronger economy and able to quickly open up other phases. It really does come to you. We're in this together, and together we will get through it. I now would like to welcome via a video message Dr. James Hildreth of Meharry Medical College.
Good morning, Nashville. I had a prior appointment this morning, so I cannot be there with you in person, but I still wanted to speak to you about on this important day. I've been confirmed with Mayor Cooper and Dr. Jahanger about the decision to move forward to phase 1. This is a moment that had to come, but it's also a moment where all of us need to step up and do our part as Nashvillians. We will not be successful in phase 1 unless we follow closely the guidelines that have been laid out in the plan to reopen safely. Nothing has changed about the virus. It's still out there. It's still infecting people. So we have to be on our guard. We must protect ourselves and others, just like we've done for the past several weeks. And we've done that quite well. This means that you must stay at home unless you just have to go out. And if you do leave your home, you need to wear a mask or a face covering. This is especially important for people over 65 or those who have underlying conditions that we've talked about. And by all means, wash your hands, stay 6 feet apart from those that are around you, and protect your T-zone. Do all those things that we've talked about. Nashville, we got this. Stay healthy and stay safe.
Thank you, Dr. Hildreth. I'd now like to introduce Dr. William Schaffner of the Vanderbilt University School of Medicine. Dr. Schaffner, you're on the air.
Well, thank you, and good morning, everyone. Mayor Cooper and my friends, Dr. Jahanger, Dr. Caldwell, Dr. Hildreth, I'm glad to be with you. This is an important occasion for my favorite city. Mayor Cooper, in close consultation with medical and public health advisors, has announced that we are stepping cautiously forward into the new normal. I emphasize 2 words, we and cautiously. This was not an easy decision. It's a balancing act, trying to steer between the rock of its potential medical consequences and the hard place of continuing severe economic distress for many. We together can steer through these hard times if we all help each other to do it cautiously. The contagious and I'm afraid deadly COVID virus is still with us, as Dr. Hildreth just told us. So we must maintain social distancing. Yes, continue to wear those masks when you're out and about. Maintain 6-foot distancing and perform hand hygiene frequently and enthusiastically. Those who are older and those with chronic conditions should be cautious. We're in this together to protect each other. I had a personal suggestion that was incorporated into the plan. All employers should provide hand hygiene products for their staff and patrons. Employers should insist that employees wear masks when dealing with the public. I wish that every store or facility that deals with the public would put a sign on their front door that says in a friendly fashion, "We would appreciate it if all patrons would wear masks to protect the employees who are here to serve you." We're all in this together. Let us all respect and care for each other by going forward into the new normal, cautiously, carefully, and together, as safely as possible. Thank you very much for the pleasure and the privilege of being with you today.
Thank you, Dr. Scheffner. I'd now like to introduce DeCosta Jenkins, President and CEO of Nashville Electric Service.
Good morning. First, let me thank Mayor Cooper for your support of our crews as we continue to work to restore power throughout the service area. On Sunday evening, 132,000 of our customers were without power as major storms moved through this area. This morning, power has been restored to over 126,000 of those customers. I'm extremely proud of our crews for their hard work, but we still have significant work to do. As of this hour, approximately 7,000 of our customers remain without power. If you're one of those, please know that we're working as quickly as possible to restore your power. I know the past few days have been difficult, but our crews will not stop working until power has been restored to each and every one of you. We want to thank you for your patience. We have moved from phase one of our process, where we have been repairing infrastructure, and moved into phase two, where we have been repairing the outages impacting the most customers. And by the end of the day, we'll be working on much smaller outages. So a number of times I get answered, "Mr. Jenkins, why is there nobody in my area?" And again, because of the priority, smaller outages have not been worked yet. But now, starting today, we'll be working the small outages. Now, this week's storm is just the most recent incident impacting many of our customers. Many were impacted by the March 3rd tornado, and still others have been challenged to pay their power bill due to the impact of COVID-19 on our local economy. To support our customers during this challenging time, NES offered a grace period that included waiving of late fees and delayed termination of service for non-payment until May 31st. It is important to us that NES aligns with the mayor's timeline for reopening the city. And so this morning, I'm pleased to announce that NES will extend its grace period for non-payment and waive fees until June 30th of this year. We want to do everything we can to support our customers who are faced with the financial challenges during this time, and we hope this helps. Thank you for your time this morning. Mayor Cooper, thank you for your leadership and your commitment to getting Nashville back to normal as soon as possible. Thank you.
Thank you, Mr. Jenkins. We'll now start the Q&A segment of today's briefing. As I announce your name, you may proceed by asking your question over the air. We'll start with Brett Kelman at the Tennessean. Brett.
Hi, good morning, everyone. So I have heard numerous officials say many times that you guys are looking at many metrics when factoring this decision. I think it's been repeated over and over and over again. However, in the initial roadmap for reopening document that you guys released, the count of new daily cases was described, and I quote, as the first and most important metric for progressing into phase one. Now, you guys are taking the step, even though that is the main metric that is not aligned with your goal. Do you feel that that metric was overstated in importance in that initial plan? Or are you so confident you can move forward, even though that metric is still not where you said it should be?
Thank you for the question, Brett. Dr. Jahangir.
Brett, thank you so much. And you're right, and I still stay, many metrics determine our decision. And yeah, we would like to have that general case trend be stable and around, I think, the 80 range. And I will say, if you do the math, if you take out the clusters we had of past several days, the average over the last 3 or 4 days has been in the 80 range. But I want to say that it has been, that's one metric. I think what is important is we're not at that 400 case a day thing that potentially could have been a trajectory. I've discussed the other metrics. We talked about doubling time and other things, but yeah, that is a metric that we mentioned, and we evaluate all of them as we move forward. I think if one doesn't evolve with this virus and recognize differences as every day goes on, it could be very dogmatic. But I think if you look at our average, the past 3 or 4 days, we are in that 80 range. You can take out the clusters. Thank you.
Julia Palazzo, WKRN. Julia?
Hi, good morning, everyone. Dr. Jahangir, if reopening of phase one does go well, will you guys speed up the time between phases, or are you still sticking to that 14-day period? And also, will Music City centers still be ready to go in case we do see a major spike and hospitals begin to be overwhelmed as we reopen? Thank you.
Thank you. Dr. Jahangir?
Hey, thank you for that. Right now, the roadmap's every 14 days, and I suspect we'll stick with that. Now, that's not to say there may be some amendments to the phases, or perhaps certain things may get moved. Again, this is a roadmap. It's not dogma. We'll if amend as needed. Regarding Music City Center, now many weeks ago, the decision was made that we didn't need Music City Center, and there are plans for other alternative care sites in our community that yes, are ready and would be ready. In fact, I spoke with Commissioner Fiercy this morning about this exact issue. So I know the Unified Command, Mayor Cooper actually spoke yesterday as well about the alternative care sites. So it will not be a Music City Center, but yes, there are plans to have alternative sites if needed. Thank you.
Harriet Wallace at Fox 17. Harriet?
Hi, good morning. So I've got a few questions. First, with regard to the masks, we had 25,000 masks yesterday. All are gone. I know last week there was discussion. I asked how we plan to enforce people, require them wearing masks, but we don't have the masks to give them. And I've been contacted by a daycare, by a nursing home that don't have masks. And it was my understanding that the city was going to work with the state to get them those masks, but now they're gone. So what is the plan for that? And are we going to get more masks? And what happened yesterday that should not have happened? Because honestly, I write, I don't sew, so I can't just make a mask. And people have not been working, so they may not be able to afford to buy them. So what is the plan? My second question, Redneck Riviera announced that it's going to go ahead and open tomorrow. Mayor Cooper, I'd like to get your thoughts on that, and other businesses that are saying that they're going to reopen because it's time for that. And then lastly, we're seeing clusters, as you all have mentioned, especially in the south part of town. How can we approve reopening, knowing that that area is not under control, how are you going to protect those people in that area and your response to them? Thank you.
Thank you. Dr. Caldwell.
Good morning, Harriet. It's important to know that the first shipment that we got from the state has been exhausted. That's good news. There are 25,000 more masks in people's hands. There's going to be additional shipments. We know that making masks is quite easy, and it is online. The Surgeon General has shown how it can be done from just household items. So we want to encourage people to continue to look at that, and we're going to work with others to try to enhance those efforts so people know how to use masks. We're also going to be working with businesses to make sure that they also can have masks provided for people, absolutely their employees. We're going to be requiring employees to be wearing masks now, but patrons who come in are also going to need to have masks, where we'd like every business to work to provide masks if they do not have a mask. But it is best and most sanitary for people to have their own mask, cloth mask, so that then they can launder them and use it throughout the community. Thank you.
Thank you, Harriet. Thank you for the questions. You know, the state really is committing to help provide masks. And your other questions, they need to be in compliance with public health codes. If they have a permit, you know, public health has every reason to withdraw it. But as in my earlier remarks, I want to talk to the public and to customers. It's the responsibility of the business to help keep you safe. If they are not doing that, don't patronize that business. That's pretty blunt, but that's what we're going to have to depend on going forward in the future. We're going to enforce. Phase one is about enforcement, but in the meantime, there's no enforcement as much as the goodwill and reputation of your business to the public. And if people are aggressively demonstrating that they don't care about public safety, then the public has every right to withdraw their business. Now, as for disease clusters, part of moving on from safer at home is that safer at home is not keeping everybody safer at home, and we need a targeted tactical response to where the disease clusters are happening. And that's going to, I hope tomorrow we're going to have a lot more details about that. That is beefing up enforcement, that's getting deeply involved in contact tracing and helping the community. It's about keeping our essential workers safe. We were not keeping our essential workers completely safe in the last order, in the last phase. They're going to have to go to work in all phases. We're not keeping them safe in the past phase. We're going to make every effort to do a better job with that. Now, seniors too. Essential workers and seniors and clusters, particularly workplace clusters are going to be something that the Public Health Department is going to aggressively look after. We've got the capability now to trace that. They have the capability to do the detective work to begin to keep us safer. So in that framework, we have to, as a community, accept the responsibility of going forward to helping each other and add to our enforcement efforts. Thank you.
Chris Davis at News Channel 5. Chris.
Morning. Are businesses allowed to reopen if they don't have the thermometers to screen their employees? And then one other question, and just to kind of continue what Mayor Cooper was just talking about, when it comes to enforcement, you say that's going to be an emphasis in phase one. How will that be different in phase one than it's currently being done? And if there's overwhelming need for more, is the city prepared to enforce more when it comes to businesses?
So your first question was about thermometers in terms of assessing employees, and your second question was about phase one enforcement. Dr. Jahangir.
So, you know, we're gonna hope people phase in with the thermometers. Just Commissioner Ezel's, the Tennessee Promise Tennessee Pledge site actually has a link to where you can get thermometers. So the state of Tennessee has been working on that because this is also part of the Tennessee Pledge requirements. You know how one does that, whether it's a thermometer at the place of employment or employees using our code. We're gonna give you guidance on that, but you can open as long as there's screening processes. Regarding enforcement, yeah, we're increasing the number of enforcements. The money's out there that the mayor has approved for exactly this purpose, and our Caldwell and his team are hiring people as we speak. I believe the mayor said 20 or more individuals already are being hired, and more will be hired as needed. So thank you.
Our final question today is from Kara Hartnett to the Nashville Post. Kara.
Hi, thanks for taking questions. I have a couple. My first is, do you plan to stick to the 8-week timeline for the reopening plan? And can you talk more about our reach of our contact tracing initiatives? Do you know what percentage of new cases are being identified through that?
Thank you, Kara. Dr. Jahangir.
So first of all, regarding the 8-week thing, as we mentioned, this is, if things are going well, every 14 days right now, the roadmap has us expanding to the next phase. So in theory, if every 2 weeks we're at a good place, then we'll advance. As I mentioned, this is a roadmap, right? So things move back and forth, perhaps. So stay tuned, this is continuing evolving. But as it's laid out right now, yes, in 8 weeks, we should be in phase 4, assuming everyone does their part and we continue to see stable cases, doubling time stable, hospitalization stable, public health capacity stays where it is in testing. Regarding the number of new patients that are identified from let's say somebody tests positive and contact tracers call them, around 36% currently of people that are contacted that may not know they have the virus initially are recognize the need to get tested because they are contacted by our public health officials. So 36% right now is that number. Thank you.
We've addressed all the media questions in the WebEx queue this morning. I'd like to thank Dr. William Schaffner, Dr. James Hildreth, and Mr. DaCosta Jenkins for participating in today's press briefing. A recording of this event will be made available later this afternoon. Thank you for joining us. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.org.